Central Denmark region is created in 2007 as part of the Danish municipal reform, which consolidated 13 counties into 5 administrative regions. The administration's main responsibility is providing healthcare services to the region's 1.2 million inhabitants. As a result of this consolidation, the region had to integrate a lot of different IT resources and systems for the 30,000 employees of the region. And we selected Identity Manager from NetIQ to build a consistent and centralized identity management architecture.
We decided to extend the functionality of our Identity Manager solution by developing a self-service web portal. This portal automates the granting of certain user access rights and enables local departments to grant access to their own users.
One of the specific tasks of the management system is to administer digital certificates for the 30,000 employees, or those of them that are accessing critical clinical applications.
Our portal is linked to the master directory of employees, and it's built using Identity Manager, which in turn is integrated with the payroll system. So, when an employee is added to the payroll system, for example, Identity Manager automatically creates the employee's login credential and then provisions basic access rights based on the employee's role in the organization. Department managers can then use the portal to assign specific applications to that person.
The solution can also grant access rights to multiple departments based on user affiliations. This is useful as many employees often have more than one affiliation, such as a doctor who works on several hospitals.
Our new portal helps us to provision access rights much faster. Previously, users had to request access to individual applications and we had to manually grant them access rights. And now, the portal has automated that process and assigns a number of basic rights without the need for manual intervention. It's great because this has considerably reduced the workload for our IT team, which means that we can focus on more important tasks. We've integrated more than 30 systems into the solution, including corporate email, electronic patient records and a number of clinical systems. In all, the system manages a total of about 43,000 monthly changes. We've been able to increase security by delegating the provisioning of user access rights to department managers. The big benefit to us is that local teams can now guarantee that the right people have access to the right applications.
One of the important aspects is that the Identity Manager allows us to load the digital certificate into the application when the user logs on. That's an important feature because it allows the clinician to access critical clinical information quickly. Identity Manager also allows us to synchronize user credentials across applications. That's important because it allows us to have more complicated passwords because the clinician and the user only has to remember one.
For us, the key benefit of Identity Manager is that it enables us to update user details throughout all systems from a single point of control. The other thing we really like is that we can create a single user identity with multiple access rights for different applications. We find that this helps us keep better track of users on the system and improve efficiency and security across our entire organization.